And let me just start out by asking you, why are you the right person for this job?
Well, I am the right person for this job because I am a problem solver. And our country is facing some really challenging situations right now. Coming out of this pandemic fully is probably top of mind, but we also have some long-standing challenges that need to be addressed, like the systemic racism in so many of our institutions and communities, and how we're going to rebuild our infrastructure while still making sure that we address climate change. I've been a problem solver my whole career. As a doctor, my job was to diagnose the problem and work with the patient to figure out how to solve it. I saw, though, very clearly over time that many of my patients had problems with their health that were due to things outside of the exam room. So I became a public health advocate, and I worked with President Obama to help pass the Affordable Care Act. I'm really proud of that work, but I knew that a lot more needed to be done. As chair of the Montgomery County Board of Commissioners, third largest county in the Commonwealth, I've been leading through this pandemic, but I've never taken my eye off the ball on the economy and continuing to repair our infrastructure. And what I've seen over and over again is that so many times when Washington tries to solve a problem, they actually end up making it worse. So I am eager to bring my problem-solving abilities and my determination to cut through the noise and dysfunction in Washington to actually get some stuff done for people here in Pennsylvania.
Let's talk a little bit about how this pandemic has gone and the experience with it over the past year. How would you assess how Pennsylvania has handled the pandemic?
Well, I think that one of the things that this pandemic points out is that much like many other types of infrastructure, our public health infrastructure has been very underfunded for decades. And we saw, particularly in the early days, some real struggles because of that, both on the just general IT side that the Pennsylvania Department of Health had available to it, what we had available to us at the county. We saw it in the availability of testing. It was really slow to get testing stood up in this country, and that was a big challenge that we all faced. So we've solved these problems all along the way, and thankfully we are now rolling out vaccines in much greater doses, so we'll be able to get our communities vaccinated. But it is one of the problems that I'm committed to working on in Washington because it did not have to be this hard, and I want to make sure that we are fully prepared as a state and a country for the next time that this happens.
So we know that we may have to do this again when it comes especially to vaccinations. How should things change in terms of the relationship between the federal government, the state government, and the counties? You've been working on the county level. Do you think when we do this again, the federal government should handle everything? Do you think the counties should handle everything? Or should the structure stay the way it was this time?
Well, first, I just have to comment that it is nothing short of a miracle that 1 year into this, we have 3 vaccines approved for use that are safe and effective. And if you had told me that a year ago, I would have thought you were crazy. So I just have to point out that it is our research infrastructure that has been so critical to this work. Research, particularly on the mRNA technique, is what allowed these vaccines to be ready so quickly. So we're very fortunate there. In terms of the actual rollout, I think one of the places where this got derailed is that there were pre-existing plans for how to respond in a pandemic to large-scale needs for either antibiotics or vaccines. And I don't know exactly where it got a bit derailed, but somewhere in this process, existing plans were set aside and other plans were put in place. And so that made communication a little confusing. Like, for instance, in our county, we were assuming a certain set of steps would happen, and actually something slightly different happened. So that is something that I think needs some serious after action study so that we can understand where the opportunities for improvement are. I'm certain we can do it better.
So let me make sure that I understand, though. Do you think the counties should handle more of it going forward and the federal government should just give vaccine to the counties? Or do you think there should be some other structure when we have to do this again?
I'm not in, I just can't answer that question right now because I still don't fully understand exactly where things went wrong. So I think that's a question that just needs further investigation. Once we're on the other side of this, I don't want to divert anybody's time right now to anything other than getting shots in arms. But I think once this is settled down a bit, that is something that we need to dig into because I don't know exactly how this got so derailed.
One of your competitors in this race on the Democratic side is the lieutenant governor. Obviously, there has been some criticism of the Wolf administration for the handling of it. Do you think that throughout this race, it will be fair for the lieutenant governor to answer for the administration's decisions?
Well, that's something that is between the lieutenant governor and the voters. I'm here to talk about my race and why I'm running and what I'll do for Pennsylvania should they choose me to be their senator. I am focused on Pennsylvanians, on rebuilding our economy after this pandemic, rebuilding our infrastructure after this pandemic, roads, bridges, and preparing for the next pandemic, and focusing on healthcare costs and climate change. Those are the issues that I think are most important in this race. At least that's what I'm hearing from Pennsylvanians all across the Commonwealth.
I want to talk actually about the infrastructure plan in just a moment, but I want to just button up the pandemic part of this. You had to make, as many officials across Pennsylvania and the country had to make tough decisions during the pandemic. They weren't always popular. You had people protesting outside your home at one point. Do you stand by all of the decisions you made during this process, or are there things that maybe you wish you had done differently?
What I stand by is that every decision that I made at that time was made with the best information and data that we had available to us. One of the decisions that I wish we had done differently from the very, very beginning was the understanding about the importance of masks. In the early days, we were hearing both from the CDC and the World Health Organization that this virus was not primarily spread through respiratory droplets. As I'm sure you remember, we were much more concerned about cleaning surfaces, and that's important, but there was a real lack of understanding of the importance of the respiratory spread of this disease. So if I could do one thing over, it would have been to have more data, more information on the importance of respiratory spread, asymptomatic spread, and ask people to start wearing masks from day one. I think if we had done that across the United States, we would have seen a very different situation.
Do you think we'll need to continue to ask people to wear masks?
It's quite likely that for some period of time we will. It is still going to take a while to get the 75 to 80% of this country vaccinated that we need in order to establish herd immunity. And it's not clear yet how effective all the different vaccines are against the variants, which are a growing proportion of cases here, certainly in the Southeast. So for now, the message is the same, vaccinated or not. If you're outside of your home, we're asking everyone to continue to wear those masks for the safety of everybody in the community.
President Biden has now passed his first large piece of legislation, the American Rescue Plan, and is talking about that next one, the infrastructure bill. They are very expensive. Are you concerned about that at all?
Well, first of all, I just want to say that I was so pleased to hear the president's announcement in Pittsburgh last week of this critical American jobs plan. It will place the United States in a very competitive place for the 21st century by fixing our crumbling infrastructure, providing lots of good paying union jobs here in Pennsylvania. And these are things that I hear from people all across the Commonwealth that they want. I do believe that we should pay for it. And I think there will ultimately be a number of proposals to do so. But I also think what is frequently missed in this discussion is the cost of not moving forward with this plan. We know here in the Southeast, we have seen tremendous storms, these, once in 100-year storms, and we've seen several of them in the last several years, and it's causing flooding and all kinds of property destruction. So we have to take action to improve our infrastructure, to take steps to mitigate climate change. And the cost of doing nothing will be much greater than the cost of President Biden's proposal.
President Biden is proposing a corporate tax increase, but he's also talked about the possibility of other tax increases, although not on anyone making less than $400,000. Would you be comfortable voting for a tax increase on Americans, and where would be your threshold?
As a senator, I would be focused on making sure that we had a fair tax system for working families. This has been a struggle for decades, and I think we have a long way to go still to making sure that working families have a fair shake in our current tax structure. I do think that corporate taxes were lowered quite a bit under the last administration. I do think there is room to increase those taxes. So I would look at a bill holistically. I would want to understand its impact on all the different constituencies.
But would you be okay with an individual tax increase of some kind?
Well, I can't comment on something hypothetically. I would need to see what the impact is on working families. That would be my number one focus.
I know that in Montgomery County, one of the policies that has been discussed at the federal level that you have already taken action on is the minimum wage, but you were able to do so very narrowly. There is discussion on the federal level of how to do that. Would you be in favor of raising the minimum wage at the federal level? To what point, and how would you do it?
Well, I believe that someone who's working 40 hours a week should be able to feed their family with one job, not three. So addressing that issue in Montgomery County, we have raised our minimum wage for our county employees, and there are 2,700 of them. We raised our minimum wage to $15 an hour. It took us 3 years to implement that program. This is not something that you can do overnight. Additionally, we put in about a year ago a gender-neutral paid family leave policy for the birth, adoption, and fostering of a child. These are the kinds of family-focused policies that I strongly support. And by the way, we've been able to do that in Montgomery County while still maintaining some of the lowest county property taxes in the region.
The federal minimum wage is one of the things that that Democrats could have trouble getting through the Senate with such a slim margin. Are you in favor of eliminating the filibuster or changing it in some way?
I believe that the voters send us to Washington or any elected office to actually get things done for them, to address the challenges in their day-to-day lives. The filibuster has been used as a tool of obstruction for decades. And because my role, and I think if I am lucky enough to be elected by Pennsylvanians, will be to get stuff done for them, I would oppose, or let me say, I would support getting rid of the filibuster.
We know you in this area. However, Pennsylvania is obviously a large state. What are you doing to get to know folks in other parts of the state and connect with them?
Well, first of all, as a county commissioner, I work with county commissioners from all 67 counties and have been doing that for 6 years. So I have many colleagues and a deep understanding of what's going on in counties, large and small, all across this Commonwealth. And I'm talking to voters. There is nothing more important than that. I've been doing a lot of that by phone and by Zoom, but I look forward to the day when we can actually travel in person. But here's the important thing. When I talk to those voters, I hear the same themes from all across the Commonwealth. People are worried about how we're going to fully get out of this pandemic. What's going to happen to the economy, particularly for women and moms? So many women and moms and other parents have had to leave the workplace because of the events of this last year. They want to have an understanding of what's going to happen this fall with their kids and if they're going to be able to get back to the workplace. People remain worried about our infrastructure, not just roads and bridges, but good internet access, a reliable electrical grid, and how we're going to respond to these mega storms that we've been getting. And of course, healthcare costs remain a problem for so many people, particularly the price of prescription medications. These issues are shared by all Pennsylvanians, and I look forward to discussing my thoughts on these issues, but most importantly, listening to them and helping to lift up their ideas as a senator.
I want to wrap up just by asking you about a potentially historic nature of your candidacy. If you were to win, you would be the first woman senator to represent Pennsylvania. How do you think about that? And do you think the voters should think about it?
Well, I think there's actually a couple different ways that history could be made in this race. And what I hear when I talk to the voters is that they want to believe and trust the person that they're going to vote for. And most importantly, they want to believe and trust that that person is going to stand up for them in Washington and commit to cutting through the noise and dysfunction to actually improve their lives. And that's what they're going to get if they vote for me.
Thank you so much for your time. I appreciate it.
Thank you.
Good to see you. We'll talk again.
Take care. All right.